my name is Stephanie, and I'm going to be your nurse. Wash your hands and pull this curtain for you. And I'm going to look at your bracelet. Can you tell me your name and date of birth? John Doe, blah, blah, blah. Alright. And are you allergic to anything? No. No? Alright, good. Alright. Now we're just going to do an abdominal assessment and make sure your belly is raised up. This one just doesn't move. Okay. Alright. And I'm going to listen to our belly, all 4 quadrants.
But I heard sounds in all 4 quadrants. And I'm just going to palpate just to see if there's any normal,
Good, normal, active bowel sounds.
just any abnormalities. Alright, everything feels soft.
Alright, and I'm just going to palpate, tell me if you feel any pain or tenderness.
Okay. So
Alright,
now I'm
Luke.
going to
Okay.
just measure out the
Alright. Well, what we're going to do today is put in the NG tubes that your doctor ordered. Ready? Alright, we're going to place this under your chin. Maybe you don't
I'm
get
going to just
anything on
place
it.
this underneath you just to catch any secretion.
Okay, I'm going to put this near you with some tissue. Alright. This will normally come in a package.
And I'm actually going to place this too. So this is a tissue in case your eyes start watering, and this is a drinking cup if you need it right for later.
Alright. Okay, now we are going to measure the tube so that we know how far to put it in. We're going to measure from your nose to the tip of your earlobe, and then measure down to the xiphoid process. Locate it.
Alright, so I'm just going to measure this
And
out.
then at the mark, you will
Down
apply a piece of tape. Just kind of tricky. Close.
your ear.
Good.
Into your xiphoid process. So I'm just going to
Alright, and now we are going to lubricate the tip 2 to 4 inches. Okay.
Okay, and I'm going to mark this.
Alright. Now I'm going to hand the patient some water. So what I'm going to do is insert it a few inches, and then while I do that, your head will be tilted up looking towards me, and then as soon as I tell you, I'm going to have you put your chin to your chest and start taking sips of water. It's going to help the tube go
Okay,
down.
and I check the patient's orders.
Alright, so the patient's head is tilted up at the moment. Alright, as soon as the patient starts gagging or I meet resistance at the pharynx, go ahead and tilt your chin to your chest. Start sipping water. Make sure to stop whenever the patient breathes.
And so this patient is.
And we're going to insert all the way until we
So
get
I'm actually going to start the
the
sectioning.
taped mark.
And the order also said 135. So I'm
Alright, and once we reach there, we are going to
125.
place a loose piece of tape on there until we make sure that it's in the right
So now I've
spot.
marked my tube with a tape.
And tape is going
Hello,
on.
my name is Kendall, and I'm your nurse today. Some hand hygiene.
So now
Can you go ahead and state your name and date of birth for me? John Doe, XXXX. Alright, perfect. I'm gonna assess your abdomen real quick.
Okay, well, it will not rub.
Do you need assistance?
I'm inspecting.
Alright, we were just going to say it's temporarily taped because the tape is not working. Okay.
I'm concerned
And then
that
once
you
it's
have an
temporarily taped
expectation about
loosely
their
while you
allergies.
check, you're going to check for placement.
if
Going to
we also
remove the
apply like
clamp,
a.
insert your syringe and aspirate gastric contents. While you aspirate it, you check it, make sure it's normal color, consistency, all that.
And I heard bowel sounds in all 4
And
quadrants.
then we are going to test the pH with a pH strip. You have to do it within like 30 seconds.
So I'm going to insert it. I'm going to have the client position
And
their
you
head,
compare it with the color
back
chart.
Do you have any allergies?
Alright, and it looks good.
Okay. Well,
And then,
I have an order to
And so
But I
you
feel
put
like
that.
this
an
is
NG
going to
tube.
position the
It's gonna go down your
chin
nose
to the
to your
chest, and also
stomach.
if,
It's
to help
gonna
me
help
out, I
alleviate
can
some
also
of your
have
nausea.
this
Alright, and now that we know that it is in the correct
Come over here.
placement,
Sit over this.
So
Over
because my
I'm going
patient
to
is
secure
really
it.
big right
here.
now,
The end of it.
I'm going to insert it. The nose. And then I would have the patient tilt their head to the chin.
you secure it,
So we're
and
just gonna
get this out of your
verbalize
mouth.
that because it's kind of hard to.
Now we are
So I'm
suction
going to go
to intermittent.
all the way down.
And we want to make sure that we test it.
Until where my tape
Alright.
is.
And I'm going to drop your bed rail.
Alright, too high. It needs to be between
Put on
100
my clean lips.
and 150. Alright, good. Alright, once you make sure that it's correct, you can attach the patient to suction. Right, and you will use this measuring
Okay.
to
So I
measure the
bent
length of it
nose.
so that it'll help
Tape,
future
I measure to
placement.
the nose.
I'm gonna go ahead and put this pad on your chest.
Alright, all the way down.
So I'm going to
So
go
we've got
down.
about 20 inches. Alright, so we'll make sure to document that. That way we'll know if the tube moves, if there's any more length added to
So I'm
it.
going to
Here's
put on the loose tape
and some tissues just in case.
for securement, just for right now.
Make sure this is nice and lubricated.
And I'm going to take off my
Alright,
coat.
and then we are all done. Is there anything else you need?
I'm going to aspirate
Alright,
the
patient says
secretions
no.
from
I'm
the
going
Take
to
this
Hopefully
off,
stomach.
perform hand
make sure
hygiene,
that my
and make sure
suction
the bed is back in the lowest position and the patient is comfortable.
over here.
We're going to make sure that we pin this to the gown. We don't actually have a rubber band or pin, but we want to make sure that this is pinned to their gown and that the air vent stays above the stomach level.
It's between the
Pin this now onto the pH strip.
That looks good.
Alright, that's it.
And then I'm going to